Our next segment speaks to the many folks who are struggling with hair loss. Founder of Great Hair Transplants, Dr. Brett Bolton, joins us with information on how to slow down hair loss before it starts. Doctor, thank you so very much for your time today. A lot of men hear mixed things about finasteride. From your perspective, what should someone realistically expect when they start taking a 1 milligram daily?
Okay, first of all, thanks so much for having me. Yes, 1 milligram daily of finasteride is my go-to. I always will start off with prevention. Prevention is always the key because we want to help you hold on to as much of your existing hair as possible to minimize future hair loss. And it's a very safe medication. It's been on the market for literally 50 plus years and 5 times the dose. So we have the long-term studies. It's a safe medication and the benefits far outweigh the risks.
I'm just going to full disclosure. I'm a television show host, so I want to keep my hair. So I actually do take the finasteride. It works very, very well. So when you begin patients on the lower strength 2% minoxidil before moving them to like 5%, what signs are you looking for that tell you that their scalp is tolerating it well?
Great question. Yes, and you're exactly right. I definitely start all the patients off with the lower percentage, and it will probably say on the bottle, female. But it's the exact same product. One's 2%, one's 5%. They're both minoxidil. And what we're looking for is we're looking to see changes in the skin, whether you see unusual redness, flakiness, something that looks unusual to your skin that's different. As long as we're not seeing those changes, then we do want to bring the men up to the 5%. Because it's much easier to use. It comes in a foam. It's much more well tolerated. The guys, a lot of them use it as almost like a product. And it really also works differently than the finasteride to help keep what you have in place.
Very interesting. So some people worry about side effects like decreased libido or palpitations. So how often do you actually see these in your practice, and how do you talk patients through the risk?
Okay, so with finasteride, the number one concern is the decreased libido. However, I was mostly seeing those side effects when the patients were taking the 5 milligram tablet and they were cutting it. That was affecting its absorption, and that's where I was seeing more of the side effects. Once the 1 milligram finasteride came out, which was in the late 90s, the side effects went down quite considerably. We still do see it rarely, but it's not very common. As far as the minoxidil is concerned, that's a vasodilator. So what I'm starting to see now are patients are going online and they're now taking the oral minoxidil, which is clearly a blood pressure medication. That's how we learned it was helping to hold on to the hair. I don't recommend oral minoxidil. I think there's a lot of issues. I'm having a lot of patients call me up and say, hey, I'm getting heart palpitations. I got prescribed this online. I immediately get them off of the oral minoxidil and I have them back onto the topical, which is much more tolerated and less chance of side effects.
So you often emphasize that finasteride and minoxidil don't create new hair, but protect what someone still has. So how do you explain that to patients who assume regrowth, is guaranteed maybe?
You nailed it. That's like my challenge every day, trying to talk to a 25-year-old patient and say, hey, take this pill every day, put this lotion on your head every day, and you're still going to lose hair. But that's my reality, and I have to explain that to the patient. If you happen to have some early miniaturized hair that's going through that genetic process, sometimes you might be able to help re-strengthen that. But I always tell the patients that's a bonus. What we're trying to do is just keep whatever we can. And even if you do both finasteride and minoxidil, you can still lose hair. They're not 100%, but this is currently the best that we have. And they do work. I can tell you with confidence that these products work.
Yeah, I'll double down on that. They for sure do, because the hairline is not receding any further. All right, so there are tons of supplements marketed for hair loss. In your experience, is there any scenario where vitamins make a meaningful difference, or are they mostly noise compared to the FDA-approved treatments?
What you're saying is correct. They definitely can be beneficial for a lot of patients, vitamins. However, I will always recommend the FDA-approved treatments. And I tell the patients, if you're taking a biotin or a horsetail silica or a CoQ enzyme 10 and you feel it's working for you, definitely stick with it. I never discourage anyone to stop using something that they feel is helpful and beneficial, but that's not what I will promote, because I want to make sure I'm promoting something that's I know is safe and I know is effective. And I can't assure you that with, guaranteed with vitamins and other supplements.
Doctor, fascinating conversation. I really do appreciate your time today. You've set me a bit at ease with the finasteride. So where do we go to learn some more information?
So you're welcome to go to my website. GreatHairTransplants.com has a lot of information about all this fun stuff. And I'd be more than happy to discuss this with any potential patients that are interested in a follow-up.
Fantastic. Thank you very much, Doctor. We appreciate your time. And guys at home, if you want to catch this segment again or others like it, just head over to First Coast News Plus.